Hi, today we're going to be doing a primitive reflex exam on a baby. Primitive reflexes are involuntary motions that aid in the development of certain skills in babies. These reflexes are usually inhibited by 4 to 6 months of age as the brain begins to mature and replace them with voluntary motor activities. However, some of these reflexes may return with the presence of a neurological disease. So first, we're going to be forming suckling. Suckling reflex is important for breathing and swallowing. We can observe this reflex by stimulating the oral region by inserting an object, like my finger, into the mouth, like this. A positive would be the baby should instinctively suck on my finger, and a negative would be the baby doesn't begin to suck on the finger. And this reflex usually disappears at 4 to 6 months. And the next one is the rooting reflex. It is seen in a response to a light stroking on the cheek or bringing an object into the patient's visual field. I'll take my finger and stroke the baby's left cheek like this, and their response should be turn their head towards the stimulus, toward the left. Rooting begins around 32 weeks of gestation and disappears after 1 month. Positive would be the baby turns to the side of stimulus, and negative would be the baby doesn't move. Next will be the palmamental reflex. The palmamental reflex involves a twitch of the chin muscles when a specific part of the palm is being stroked. So with the tip of my thumb, I will stroke the palm of the baby like this, looking for a response in the chin muscles or such as a lower lip elevation. Positive would be the chin muscles twitching when the palm is stroked. Negative would be no response, and this disappears around 6 months. Next, the glabellar tap. The glabellar tap reflex causes them to blink when the glabella, or this area between the eyebrows, is tapped repeatedly. A positive would be baby blinks when tapped but stops after 4 to 5 times. And negative would be baby keeps blinking even after the 4 to 5 taps. And there is no age that this disappears. 1, 2, 3, 4, 5. So the baby should keep blinking, but after the 4 or 5, they'll stop blinking. Next, the tonic neck reflex, and this is performed by turning the infant's head to one side, which results in the infant extending the arm to the side of the rotation and flexing the other arm like this. Positive would be the extension of the arm on the same side of rotation and flexing of the arm on the opposite side. A negative would be no response. This disappears at 3 months old. Snout. The snout reflex is when the lips pucker after pressure on the upper lip. So I just use my finger to press right onto the lips of the baby, and it should pucker to protrude. So I press the baby's lips just like this. Positive would be the baby would protrude lips out into a pucker. The negative would be the baby's lips don't protrude out. This goes away around 4 to 6 months. Next, the Moro. The Moro reflex will occur when the infant hears an unexpected noise or an unexpected movement. So I will lay the baby on their back and pull up their arms, then let go. So I'm going to do this. With the loud, unexpected noise, the baby will extend the arms up with the palms up, then move the arms back down, and sometimes cry after, just like this. They'll be on their back. And negative would be no response, and this goes away at 6 months. Last reflex is the grasping reflex. The grasping reflex can be elicited by providing a sustained pressure on the palm of the infant's hand. So I'm going to put some pressure into their hand, and they should grasp onto my fingers like so. Positive would be infant's flexion, fingers flex and grasp object, and the negative would be no response. This disappears at 6 months. Next, we are going to check the leg length of the babies. So, on a baby laying flat on their back, their legs should be even and their knees should be in a line. Next, we're going to do orthodonty test. This helps identify a dislocated hip that can be moved back into its socket. The baby is laying on its back with its hip flexed to 90 degrees, and I'm going to abduct the hips while applying anterior force to the femur to reduce the hip joint. And then an indication or a result of this, there may be a palpable clunk as the femur pushes back into the socket like this. I'm gonna here, just like this, and push out. Lastly, the Barlow test. The Barlow identifies an unstable hip that can be passively dislocated. The infant is on its back with the hips flexed to 90 degrees, like the other one. But this time I'm going to adduct the leg in while applying a posterior force to promote dislocation, like this. And the result would be a palpable clunk, may be detected as the femur exits the socket, like so.